Hey everyone, and welcome. Today we're doing a deep dive into the integumentary system,
Ooh, the integumentary system.
specifically burns.
Okay.
Now, you, our listener, are a nursing student getting ready for a big exam, and you've given us a bunch of material to wade through.
Yeah.
PowerPoint slides, notes, practice questions, the whole shebang.
Wow.
So we're here to help you sort through it all, figure out the most important stuff, the need-to-know info,
Right.
all so you can rock that exam.
That's great.
We're going to uncover some surprising facts about your skin
Okay.
and what happens when it gets injured, especially by burns. And to help us connect all the dots, see the bigger picture, we have our expert with us.
Hi.
Welcome.
Happy to be here. You know, it's interesting how we often don't think much about our skin. I mean, beyond, how it looks.
Right.
But it really is a busy, dynamic organ. It does so much.
Yeah.
Protects us, regulates our temperature, and even, communicates for us.
I never really thought of it that way. Like when I think of blushing, I just think, oh, that's embarrassing. But it's really our skin, sending a signal out to the world, right?
Say, hey, look, I'm feeling awkward over here.
Right.
It's fascinating. And it also controls our temperature.
Right. Like when we sweat.
Yeah. Sweating when it's hot.
Or we get goosebumps when it's cold.
Yeah. And don't forget about vitamin D.
Oh, right.
Our skin's involved in producing that.
And vitamin D, that's essential, right?
Oh, totally. For strong bones,
Yeah.
immunity. It impacts so many things.
Wow. Okay. So our skin is this multitasking marvel.
Definitely.
But, as future nurses, you're going to have to assess skin.
Yeah.
What are the key things to look for?
So the materials you gave us really emphasize inspection.
Okay.
And palpation, actually feeling the skin.
Yeah.
Looking for any color changes, lesions, basically anything out of the ordinary.
Okay.
And then there's the tenting test. You pinch the skin and see how quickly it bounces back.
Oh, okay.
Which tells us about hydration level.
And that's super important.
Oh, absolutely.
Yeah.
Especially when you're dealing with burns.
Okay. So let's talk about burns then.
Okay.
It's crazy how many things can cause them, right?
It is. Yeah.
Like heat, obviously.
Yeah.
Chemicals, electricity.
Uh-huh.
Even cold.
Yeah.
But what really stood out to me reading through all this material is that burns are preventable injuries.
That's so important to remember.
It is.
And, as a nurse, you'll be teaching patients how to avoid these situations in the first place.
Right. Education is key.
Exactly.
Okay. So how do we make sense of all the different types of burns? Because it's obviously not just about the size of the burn.
Right. You're thinking about more than just how big it is. The material you gave breaks it down into 3 categories. Depth, extent, and severity.
Okay.
So depth, that's all about how deep the damage goes.
Makes sense.
And that, of course, impacts how it heals, how we treat it.
Right. Like with first-degree burns, it's just the top layer, like a sunburn.
Yeah.
Painful, annoying, but usually heals pretty quickly.
Uh-huh. Then you've got your second-degree burns.
Okay.
Those are where you start seeing those, painful blisters.
Yeah. Wow.
But here's where it gets interesting. With those deep, partial thickness second-degree burns,
Okay.
they might actually be less painful.
Really?
Yeah, because of nerve damage.
Wow.
But even though they hurt less, they take way longer to heal.
So the pain level isn't always a good indicator of how bad the burn is.
Exactly.
Yeah.
And that's really important for a nurse to remember to assess accurately.
Okay, good point. What about third-degree burns?
Those are serious.
Yeah.
Third degree, that's all layers of the skin.
Wow.
It can look dry, leathery, sometimes even charred.
And because the nerve endings are destroyed,
Often. Yeah.
they're painless.
Yeah,
Wow, that's kind of scary.
it is.
And my notes also mention fourth-degree burns.
Right.
Those go even deeper, right?
Yeah, down to the muscle and bone.
Oh, wow. That must...
Incredibly challenging to treat.
Yeah.
Often involves significant tissue loss.
Right?
Lots of potential complications, potentially even amputation.
Okay, so depth is obviously really important to consider.
Definitely.
What about extent? How do you actually measure how much of the body is burned?
So there are a few tools for that.
Mm-hmm.
The rule of nines is a quick way to estimate.
Okay.
You basically divide the body up into sections, and each section represents a percentage that's a multiple of 9.
Okay.
But for a more accurate measurement, especially in kids,
Right.
you want to use the Lundbrader chart,
The Lundbrader chart.
which takes into account the fact that children have different body proportions than adults.
So a small burn on a kid's hand might actually be a bigger deal.
Proportionally, yeah.
Yeah, proportionally, than a larger burn on an adult's back.
Exactly.
So location must play a role too.
Absolutely. Burns on the face, neck, hands, feet, major joints, those are always considered more severe, regardless of size.
Pretty much, yeah.
Because of the potential complication.
Right, and the impact on those vital functions.
Okay, that makes sense. And then severity. That kind of combines all those factors, right?
It does.
To determine if a burn is minor, moderate, or major.
Exactly. Severity looks at the depth, extent, location, and even individual factors about the patient.
Right.
To determine the best treatment plan.
Okay, so we've laid the groundwork for, like, the basics of how burns are classified.
Yeah.
Now, let's dig into the specific types, starting with those caused by heat.
Right, your thermal burns.
Thermal burns.
Those are the most common.
Yeah.
Things like, flames, scalds, hot objects. It's all about the heat transfer to the skin causing that cell damage.
And I was reading that if a large area of the body is burned, like over 20%, things get way more complicated, right?
Definitely. Like, if we're talking more than 20% of the body surface area, then we have to think about the systemic effects.
Right, so it's not just a local injury anymore. No, it's a whole body issue at that point.
So what happens?
Well, the body goes into overdrive trying to compensate.
Okay.
So you can see massive fluid shifts, which can lead to hypovolemic shock.
Oh, wow.
And then you got electrolyte imbalances.
Right.
That become a major concern.
So it's like a cascade effect throughout the whole body.
Exactly. And on top of all that, there's the huge risk of infection.
Yeah, why is that?
Well, with a burn, that protective skin barrier is compromised.
Ah, right.
So it's much easier for bacteria and other nasty things to get in and cause trouble.
Okay, that makes sense.
And if the burn is severe enough, the respiratory system can also be affected.
Especially with smoke inhalation.
Yeah, that's a whole other layer of complexity.
Yeah, we'll definitely have to talk about that.
We will.
Okay, so managing these thermal burns, it sounds like a multifaceted approach is needed.
Oh, absolutely.
Yeah.
It all starts with cooling the burn immediately. But then we move into medical treatment, like fluid resuscitation to get that blood volume back up. Pain management, of course.
Right.
Wound care to prevent those infections, and making sure the patient's getting enough nutrition to heal.
It's like a whole team effort.
It really is.
Okay, so we've talked about heat. What about those burns caused by chemicals? Those always sound particularly nasty to me.
Chemical burns, yeah, often associated with workplace accidents.
Right.
But honestly, they could happen anywhere.
Yeah, that's true.
We're talking about strong acids, alkalis, organic compounds.
Right.
Stuff that can really eat away at tissue.
And I was reading that the damage can continue even after the chemical is removed.
Yeah, until it's fully neutralized, it can keep causing damage.
So what do you do?
Well, the absolute priority is removing the chemical, getting it off the skin. And for most chemical burns, the best way to do that is to flush with water.
Okay, so just lots and lots of water.
Yeah, like tons of water. Flush, flush, flush.
Yeah.
But there is one crucial exception.
What's that?
Dry chemicals.
Oh, right, like lime.
Yeah, dry lime. You actually need to brush that off first before any water touches it.
Wait, why? Wouldn't water help dilute it?
In those cases, no. Adding water can actually create a chemical reaction, generating even more heat, which makes the burn worse.
Wow, okay.
It's a good reminder that you need to know which specific chemical you're dealing with before you do anything.
Right, know your chemicals.
Exactly.
Okay, so we've talked about heat, chemicals. Now let's talk about a complication that seems particularly dangerous.
What's that?
Smoke inhalation.
Oh, yeah. That's a big one.
Yeah, it seems like it's often associated with burns.
It is. It's a big concern, especially for burns that happen in enclosed spaces.
Right.
Sadly, it's a major predictor of mortality in burn patients.
Wow.
And it's not just about the heat of the smoke.
Right. The materials break it down into 3 types of injuries. Above the glottis, below the glottis, and carbon monoxide poisoning. Let's break those down one by one, starting with, above the glottis.
Okay, above the glottis.
What's going on there?
So those are kind of like a thermal burn, but to the upper airway.
Okay.
Your mouth, throat, voice box, all that.
Oof.
The heat causes damage and swelling in those areas.
And that swelling, that's what becomes the emergency, right?
It can, yeah. It can obstruct the airway entirely. It's like a sunburn, but on the inside.
Which sounds terrifying.
It is a serious situation.
So what are you looking for?
Well, things like hoarseness, trouble swallowing.
Okay.
Or a high-pitched wheezing sound called stridor.
Stridor.
That's a sign that the airway is closing up.
So with above the glottis, you're worried about immediate airway closure.
Right.
What about below the glottis? That seems more, I don't know, sneaky.
It can be.
Yeah.
Below the glottis, now we're talking about the lower airways and the lungs.
Okay.
It's caused by breathing in those toxic chemicals and all the little particles in smoke.
Right.
And the tricky thing is, the symptoms might not show up right away.
So someone could think they're fine, but then...
Hours later, things take a turn for the worse.
Wow. So what are the red flags for that?
Well, coughing is a big one,
Okay.
especially if there's black sputum, that sooty stuff.
Yeah, that doesn't sound good.
Not good. And also shortness of breath, wheezing, low oxygen levels, even with supplemental oxygen.
Okay, so those are all signs to watch out for.
Exactly.
What about carbon monoxide poisoning? It seems like that could easily be missed.
It can. Carbon monoxide is like a silent killer.
Yeah,
You can't see it, can't smell it.
right.
It's produced during combustion when things aren't burning completely.
Okay.
And it's dangerous because it binds to the hemoglobin in your blood.
So the oxygen can't get to where it needs to go.
Basically, yeah. And the symptoms can be really vague, like headache, dizziness, nausea.
So you might just think you have the flu or something.
Right. That's why it's so important to consider carbon monoxide poisoning in anyone who's been exposed to smoke, especially in a closed-in area.
Yeah, like you don't want to just brush it off.
Definitely not. It can be fatal.
All right, we've covered thermal burns, chemical burns, and smoke inhalation. Let's move on to electrical burns now. Those always seem particularly complex.
They are. Electrical burns, they're considered some of the most severe because the damage can go so much deeper than what you see on the skin.
It's not just the heat, right?
No. The electricity disrupts all those nerves and blood vessels,
Wow.
leading to tissue death below the surface.
So the burn on the outside might not tell the whole story.
Exactly. It's like an iceberg.
An iceberg.
Yeah, where most of the mass is hidden underwater.
Ah, okay. I get it.
So you can't just focus on what you see. You have to think about what's happening underneath.
So what determines how bad an electrical burn is?
The voltage is a big factor.
Higher voltage, more severe damage.
Generally, yes. And then the path the electricity took through the body.
Because that determines which organs are affected.
Right. And of course, how long the person was in contact with the electrical source.
Right. The duration of contact.
Yep. All those things matter.
Okay, so these electrical burns, they need a whole different level of assessment compared to other types of burns.
They do. We've got to be on the lookout for cardiac arrhythmias, muscle damage, even neurological problems.
Wow, okay. We've talked about heat, chemicals, and electricity. Now let's talk about injury from, like, the opposite end of the spectrum.
The opposite.
Cold.
Oh, right. Cold thermal injuries.
Exactly.
Frostbite in particular.
So frostbite, that happens when, what, skin and tissue actually freeze?
Yep. Usually the extremities.
Like fingers and toes?
Yeah. Fingers, toes, ears, nose. Those are vulnerable.
It's all about, what, ice crystals forming and disrupting the cells?
Exactly.
So instead of heat damaging the tissue, it's the cold that's doing the damage.
Right. And just like burns, frostbite has different levels of severity.
Okay.
Superficial frostbite, it just affects the skin and the subcutaneous tissue, but
But deep frostbite, that's more serious.
it is. That's when it reaches the muscle, bone, even tendons.
Oof.
And rewarming is crucial. But it has to be done carefully.
Why is that?
Well, you want to rewarm the area quickly, but you can't use hot water.
Really?
No, you want warm water, not hot. Rapid rewarming with too hot water can actually cause more damage.
Oh, how does that happen?
It's called reperfusion injury. Basically, when blood flow is restored too quickly, it can trigger all this inflammation and damage.
Interesting. So you're trying to save the tissue, but you could also make things worse if you're not careful.
Exactly.
And those practice questions really emphasize that deep frostbite can lead to, like, really serious long-term problems.
It can. In severe cases, you're looking at gangrene and even amputation.
Wow.
It's a good reminder that both extreme heat and extreme cold can have devastating effects on the body.
Yeah, good point.
So we have to be careful at both ends of the spectrum.
Okay, so we've covered all these different types of burns and frostbite. Now let's step back and look at, like, the overall management of burns. It seems pretty complex.
It is. It requires a whole team approach,
Mm-hmm.
different specialists working together. And it's broken down into phases.
Phases.
Yeah. First, you've got your pre-hospital care.
Okay.
Then you have the emergent phase.
Okay.
Then the acute phase.
Uh-huh.
And finally, the rehabilitation phase.
Wow, a whole journey.
It is. And as a nurse, you're involved in every step of the way, playing a crucial role in the patient's recovery.
All right, let's break down each of those phases then, starting with pre-hospital care.
Okay, pre-hospital care.
What are the priorities in those very first moments after a burn?
Well, the most important thing is to stop the burning process.
Okay, get them away from whatever's causing the burn.
Exactly. And then cool the burn if it's a thermal burn.
Right, like with water.
Yeah, cool water.
Yeah.
For chemical burns, you want to remove any contaminated clothing.
Okay.
and flush the area with, again, lots of water.
Lots of water. Okay. What about electrical burns?
Electrical burns, safety comes first. You absolutely have to make sure the electrical source is completely disconnected before you even go near the patient.
Wow. Okay, that makes sense.
Once the scene is safe, then you assess for any life-threatening injuries,
Okay.
and you start basic life support as needed.
So basically damage control.
Yeah, stop the burning, address any immediate threats.
Okay, so you've done what you can in those first few minutes.
Right.
Now you get to the hospital.
Right.
And that's where the emergent phase begins, right?
Exactly.
So the first 24 to 48 hours after the burn.
Yeah, that's a critical period.
It is. What's happening in the body during that time?
Well, we're dealing with the immediate effects of the burn.
Okay.
Those massive fluid shifts, electrolyte imbalances, the potential for shock.
So it's really a race against time.
It can be.
So what are the priorities?
Airway management is huge, especially if there's any suspicion of an inhalation injury.
Okay.
We might need to intubate the patient to secure their airway. Maybe even put them on a ventilator if they can't breathe on their own.
Right. And then there's the fluid resuscitation we were talking about earlier.
Absolutely. That's critical in this phase. We're giving IV fluids to replace what's been lost and prevent hypovolemic shock.
And the notes mention a specific formula for calculating those fluid needs, the Parkland formula.
Right. It takes into account the patient's weight and how much of their body was burned to figure out exactly how much fluid they need.
So it's not just like giving fluids, it's giving the right amount of fluid.
Exactly. It needs to be precise.
What about wound care during this emergent phase?
The focus is on preventing infection.
Okay.
So we're cleaning the wounds, removing any loose tissue, and applying antimicrobial dressings.
And of course, managing the pain.
Oh, absolutely. These patients are in a lot of pain.
Yeah, I can't even imagine.
So we're using a combination of medications and other techniques to keep them as comfortable as possible.
It sounds incredibly intense, like so much is happening all at once.
It can be a bit of a whirlwind.
Yeah. But then it sounds like things calm down a little bit in the acute phase.
Yeah, the acute phase starts once the patient's stable, blood pressure's good, all that. And it lasts until those wounds are closed.
Okay.
Now we're focused on preventing complications, promoting healing, and prepping for any surgeries, like skin grafting.
Okay, so what are you watching for during this phase?
Well, infection is still a big worry.
Makes sense.
So we're checking the wounds constantly for any signs of infection.
Okay.
And we're also monitoring their nutrition.
Why nutrition?
Because burns, they really ramp up the body's metabolism.
Oh, right. They need more fuel.
Exactly.
Yeah.
And we want to make sure they're getting enough protein to rebuild those tissues.
So you're supporting the body's natural healing process.
Yes. And we're also keeping an eye out for potential problems.
Like what?
Well, scarring, for instance.
Yeah.
Or any functional limitations that might develop.
Yeah.
Physical therapy and occupational therapy often get involved at this stage to help the patient maintain their range of motion, prevent contractures, and get back to doing the things they need to do.
So it's about bridging that gap between the initial crisis and the long road to recovery.
Exactly. It's a transition phase.
Okay, speaking of recovery, let's talk about that last phase, rehabilitation. What happens there?
So rehabilitation starts when the wounds are healed up and the patient is ready to get back to their life, their routine.
Okay.
It's all about getting them back to their maximum level of function and preventing any long-term disabilities.
What are the biggest challenges during this phase?
Scar management is a big one.
Right, because burn scars can be...
Oh, they can be painful, itchy,
Yeah.
restrict movement.
Yep.
Physical and occupational therapy continue to be really important here.
Uh-huh.
And we often use those special pressure garments to help minimize scarring.
Right, I've seen those.
And then, of course, there's the psychological impact.
Yeah, because a burn injury, that's traumatic.
It is. It can be a very difficult experience emotionally.
So how do you address that?
Well, psychological support is key. We need to address any anxiety, depression, maybe even post-traumatic stress disorder that might
So
develop.
connecting them with therapists and stuff?
Yes, potentially.
Yeah.
Support groups and counseling can be really helpful too.
Right, because not only is there the physical trauma, but there's the social impact as well.
Absolutely. Burn survivors might feel self-conscious, isolated,
Yeah, I can see that.
so we need to help them reconnect with the world, rebuild their lives.
Yeah, it's like healing on every level.
Exactly.
It's not just about the physical, it's about the emotional and social well-being too.
You got it.
Okay, so we've covered those 4 phases of burn management.
Yep.
And it's clear that burn care is incredibly complex.
It is. But it's also incredibly rewarding
Yeah.
to see a patient go through this difficult journey and come out on the other side stronger.
Yeah,
It's truly inspiring.
it sounds like it. Now, before we move on, we talked about all those potential complications, and infection was definitely a big one.
Yeah.
So, why are burn patients so vulnerable to infection?
Well, remember, burns disrupt that protective barrier of the skin.
Right, like that first line of defense.
Exactly. It's like creating an open door for
Yeah.
bacteria and other microbes to just walk right in.
And with larger burns, the immune system is also weakened.
Often, yeah.
Yeah.
So it's a double whammy.
Wow.
You've got a weaker defense system and an open pathway for those invaders.
So, what are the signs of infection that you're watching out for?
The classic signs are redness, swelling,
Okay.
warmth, pain, pus draining from the wound.
Uh-huh.
You might also see changes in their vital signs, like fever, increased heart rate, rapid breathing.
So, those are all signs that something might be brewing.
Exactly. And those practice questions you gave, they really drove home how important infection prevention is in burn care.
It's like a constant battle.
It can be. But meticulous wound care, using sterile techniques, giving antibiotics as prescribed, those are all vital.
Okay, so we've established that infection is a major concern. But what about other potential complications? The materials you provided list a whole bunch of things that can go wrong after a burn injury.
Yeah, it's not just infection we have to worry about.
Right, so what else?
Well, burns can affect multiple systems.
Okay.
So we have to be watching all those systems closely. We've already talked about the cardiovascular system, the risk of shock and arrhythmias, and then there's the respiratory system.
Especially with those inhalation injuries.
Right. Those can lead to all sorts of problems.
Like what?
Airway obstruction, pneumonia, acute respiratory distress syndrome.
ARDS, right.
Yeah, ARDS.
Ah.
And it doesn't stop there. The urinary system can be affected, the kidneys, the GI system can develop ulcers.
Ulcers.
Yeah, like Curling's ulcer, a stress ulcer.
Oh, wow.
And then you've got the musculoskeletal system.
Right.
Decreased range of motion, contractures.
It's like a domino effect.
Yeah.
One problem leads to another.
It often does. It really shows just how complex burn care can be.
Okay, so we've established that burn care is definitely not for the faint of heart.
It's challenging.
It is. But what does it actually look like for the nurses who are on the front lines caring for these patients?
Well, nursing care for burn patients, it's multifaceted, it's demanding, but it's also incredibly rewarding.
So you're not just applying bandages and giving meds.
No, it's so much more than that. It requires a deep understanding of the science behind burns.
Right, all that physiology and stuff.
Exactly. But it also requires a lot of compassion and empathy.
Because you're dealing with people who are going through a really tough time.
Exactly. And one of the most important things we do is pain management.
Yeah, we've talked about how painful burns can be, but there are different types of pain, right?
There are. You've got your background pain, your procedural pain.
Okay.
And each one requires a slightly different approach.
So it's about understanding the nuances of pain, not just throwing pain meds at the problem.
Exactly. We use a multimodal approach, combining different medications like opioids, NSAIDs, maybe even nerve blocks.
Okay.
And then we add in those non-pharmacological techniques too.
What are those?
Things like relaxation exercises, music therapy, distraction techniques.
So finding whatever works for the patient.
Exactly. And it's an ongoing process, constantly assessing and adjusting their pain management plan.
Makes sense. What about wound care?
So wound care for burn patients, it's pretty intense. It's meticulous. It's time-consuming.
Yeah.
The goal is to prevent infection,
Okay.
promote healing, and minimize scarring as much as possible.
And there are like different approaches.
There are. You've got open wound management and closed wound management.
Can you explain those a bit more?
Sure. Open wound management, that means we leave the wound open to the air.
Okay.
Closed wound management, that's when we cover it with a dressing.
Okay, so what are the pros and cons of each approach?
Well, with open wound management, it's easier to see the wound and assess how it's doing,
Okay, that makes sense.
but it also requires a lot more vigilance, to prevent contamination.
Right, because it's just out there in the open.
Exactly.
Huh.
Closed wound management, on the other hand, provides that protective barrier,
Okay.
and it can create a moist environment that actually helps with healing.
Okay.
But the downside is that it can be harder to really get a good look at the wound.
Right, because it's covered up. So how do you decide which approach to use?
It really depends on the individual burn, the severity, the location, all that.
So it's a judgment call based on the specific situation.
Exactly. The notes also mention surgical debridement and skin grafting.
Oh, right. When are those necessary?
So surgical debridement, that's when we surgically remove dead or damaged tissue
Okay.
to help with the healing process.
Makes sense.
It can be done at the bedside or in the operating room, depending on the situation.
Okay.
And skin grafting, that's a surgery where we take healthy skin from another part of the patient's body
Okay.
or from a donor and use it to cover the burn wound.
So basically, you're transplanting healthy skin to replace the damaged skin.
Exactly. And there are actually different types of grafts.
Oh, yeah.
Yeah, you've got autografts, which is skin taken from the patient's own body.
Okay.
That's ideal because there's no risk of rejection.
Right, their body recognizes it as its own.
Exactly. And then there are allografts, which come from a cadaver donor.
Okay.
And then there's some really cool newer options.
Like what?
Cultured epithelial autografts, or CEAs, where they take a small sample of the patient's own skin
Okay.
and they grow it in a lab to create a larger sheet of skin.
Wow, that's amazing. So you can basically grow new skin from a tiny sample.
It's pretty incredible. And we even have artificial skin substitutes.
Artificial skin?
Yeah, made from synthetic materials.
Wow, the technology is really advancing.
It is. It's constantly evolving. But even with all these advancements, wound care for burn patients requires, a lot of attention to detail.
Yeah.
A very gentle touch. It can be physically and emotionally demanding, both for the patient and the nurse.
Yeah, I bet. Okay, so we've talked about pain management, wound care, managing the actual burn wound, but we can't forget about nutrition, right? Why is that so important for burn patients?
Because burn injuries throw the body into this, hypermetabolic state.
Hypermetabolic.
Yeah, basically their metabolism is in overdrive.
Okay.
They're burning through calories and protein way faster than normal.
So, their engine is running at full speed and they need a ton of fuel.
Exactly. And if they don't get enough calories and protein,
What happens?
the body can't rebuild the damaged tissue.
Right.
And it can't fight off infection as effectively.
So, nutrition is key to support that whole healing process.
Absolutely. It helps prevent muscle wasting and keeps the immune system strong.
So, what kind of dietary changes do you typically recommend for burn patients?
Well, they need a high-calorie, high-protein diet to meet those increased needs.
Okay.
Sometimes we also need to supplement with vitamins and minerals.
To make sure they're getting everything their body needs.
Right.
And what if they can't eat enough by mouth?
If that happens, we might need to use enteral feeding.
Enteral feeding.
Yeah, that's when we put a feeding tube in
Okay.
to deliver nutrients straight to their stomach or intestines.
So they're still getting what they need, even if they can't eat normally.
Exactly.
Okay, so we've got pain management, wound care, and nutrition. Now, what about physical therapy and occupational therapy?
PT and OT, they're essential in burn care.
Yeah.
They play a huge role in helping patients regain their mobility, strength, independence, all that.
So they're working with the patients to improve their range of motion?
Yes.
Prevent those contractures we were talking about.
Exactly, and helping them relearn the skills they need to live their lives.
I'm seeing here that positioning and splinting are really important for preventing contractures.
They are.
Can you explain why contractures are such a big concern?
Sure. Contractures happen when the skin, the muscles, or tendons, they tighten up, and it restricts movement.
And this is a common problem after burns.
Very common because of the scarring.
Ah, okay.
That new scar tissue, it's not as flexible as the original skin,
Right.
so it tends to pull the surrounding tissues together.
So you got to keep those joints moving.
Exactly.
Prevent that scar tissue from tightening up too much.
That's the goal.
Yeah.
PTs and OTs use a bunch of different techniques.
Like what?
Stretching, splinting, range of motion exercises,
Okay.
all designed to keep those joints moving freely.
And I imagine they also help patients adapt to any limitations they might have after their burn.
Oh, absolutely.
Sure.
Occupational therapists, they're all about helping patients regain their independence.
Okay.
With daily activities like dressing, bathing, eating, grooming, all those things.
So they might recommend special tools or techniques to make those tasks easier.
Exactly. They're problem solvers.
Yeah, it's amazing how they help patients adapt to their new normal.
It is. It's really inspiring to see how resilient people can be.
It is. But we can't forget that burn injuries can also have a huge impact on a person's mental and emotional well-being.
Oh, absolutely.
Right. And that can obviously affect their recovery.
It can.
So how do we address those needs?
Well, we need to acknowledge that emotional and social impact.
Okay.
Burn survivors often go through a roller coaster of emotions.
Yeah.
Fear, anxiety, depression, anger, grief.
Yeah.
It's important to create a space where they feel safe to express those feelings.
So just being there to listen, offer support.
Exactly. Active listening, empathy, reassurance, those are all crucial. And we also need to be aware of PTSD.
Post-traumatic stress disorder.
Yeah. Burn injuries can be very traumatic, so we need to be able to recognize the signs.
Okay.
and connect patients with mental health professionals if they need it.
And what about the social impact? It seems like that could be really isolating, especially if the burns are visible.
It can be. People might stare, make comments.
Yeah.
It can really affect someone's self-esteem. That's where support groups can be so helpful.
Right, connecting with others who understand what they're going through.
Exactly. It gives them a sense of community, belonging.
So it's not just about treating the physical injury. It's about supporting the whole person.
Absolutely. Their physical, emotional, and social well-being, all of it matters.
Okay, so we've talked about all these different aspects of burn care, but before we wrap up this part of our deep dive, I want to touch on prevention.
Prevention is key.
It is.
Yeah.
So what are some things we can do to, like, prevent these injuries from happening in the first place?
Well, when it comes to burns, a lot of it is common sense, but it's easy to forget those things in the hustle and bustle of everyday life.
Yeah, I get that. So give us some practical tips, things that our listeners can actually apply in their own lives.
Okay, so first and foremost, never leave cooking unattended.
Okay, good word.
Especially if you're using oil or grease. Things can go from bad to worse really quickly.
Right.
And keep hot liquids and foods out of reach of children.
Yeah, that's a big one.
Always test the temperature of bath water before you put a kid in the tub.
Oh, yeah, that's a good reminder.
Simple precautions like these can really make a difference.
They can. What about preventing burns from other sources, like chemicals or electricity?
When you're working with chemicals, always wear the proper protective gear.
Like gloves and eye protection.
Exactly. Store chemicals safely, out of reach of children, of course.
Okay.
And be mindful around electrical outlets and appliances.
Right.
Especially when they're wet.
Don't mix water and electricity.
Never a good idea. Don't overload outlets.
Okay.
Make sure all your cords are in good condition.
So basically, common sense and awareness go a long way.
They really do.
Okay, what about fire safety in general? Any key things we should all know?
Smoke detectors are your best friend.
Okay, yeah.
Make sure you have them in your home. Test them regularly.
Right.
Change the batteries at least once a year.
Good reminder.
It's also a good idea to have a fire extinguisher on hand.
Okay.
And to know how to use it.
Yeah, because in a panic situation, you don't want to be figuring that out for the first time.
Exactly. And of course, having a fire escape plan is essential.
Right.
Talk to your family about what to do if there's a fire. Practice your escape route. Make sure everybody knows 2 ways out of every room.
Those are all really good points.
And they can literally save lives.
Okay, so prevention is something we can all be more mindful of.
Definitely.
All right, I think we've covered a ton of ground in this part of our deep dive into the integumentary system and burn care.
We have. It's a complex topic.
It is. Burns are incredibly complex injuries, and they can have such a huge impact on people's lives.
They can. It's a challenging field, but also very rewarding.
Yeah. And we're just getting started.
That's right.
Stay tuned for part 3 of our deep dive.
Okay.
Where we'll test your knowledge with some practice questions.
Uh-huh.
And explore the future of burn care, which is always exciting.
I'm looking forward to it.
Okay, so we've covered a ton of ground on, like, the science of burns, how to manage them, all that.
We have.
Yeah.
A lot of info.
It is, but I'm always curious about, like, what's next? Where's the field headed?
Oh, that's a great question. There's always so much happening in burn care, always evolving.
So what's got you excited? What are those big, like, what-if questions that people are trying to figure out?
Well, one thing that I'm really excited about is this move toward personalized medicine.
Oh, yeah, I've heard about that, but more in, like, cancer treatment and stuff.
Right, it's a big trend in healthcare.
Yeah.
And I think it has a lot of potential in burn care, too.
So how would that work for burns?
Well, imagine, like, tailoring the treatment to each individual patient.
Okay.
Instead of just having, like, a standard protocol that you apply to everyone.
Right, a one-size-fits-all approach.
Yeah. You're designing treatments that are specific to the type of burn, the severity, the patient's age,
Okay.
their genetics, even their lifestyle factors, all of that.
So it's like custom designed healing, basically.
Exactly.
And I've heard so much about, like, regenerative medicine these days. Do you think we'll ever get to a point where, like, severe burns can heal without any scarring?
Ooh, that's the dream, right? And it might be closer than you think. We're already seeing some incredible things with stem cell therapy and tissue engineering.
Okay.
It's not crazy to imagine those technologies being used in burn care, too.
So you could potentially regenerate the damaged skin, the tissue.
Yep.
Not just restoring function, but also, like, appearance.
Exactly. That would be a game changer, wouldn't it?
It would. I mean, think about the emotional impact of that, too.
Oh, absolutely.
Scars can be so hard to live with.
They can. They can affect people's self-esteem, their confidence,
Right.
being able to heal without those visible reminders of the trauma.
Yeah.
That would be huge.
Okay, so personalized medicine and regenerative medicine are definitely game changers.
Uh-huh.
What else?
Well, artificial intelligence is another big one.
AI for burns.
Oh, yeah. I think AI could revolutionize how we diagnose, treat, and manage burns.
Okay, how so?
Well, imagine a system that can analyze a burn injury, taking into account all those factors we've discussed.
Okay.
The depth, the extent, location, all that.
Uh-huh.
And then it generates a treatment plan that's based on the best available evidence, specifically for that patient.
That sounds so futuristic, like having a supercomputer helping you make decisions.
It's getting closer all the time. And AI could also be a game changer in wound care.
How so?
Well, imagine AI-powered imaging systems that monitor the healing process,
Okay.
detecting early signs of infection or other complications even before they're visible to the human eye.
So you could intervene sooner,
Exactly.
potentially avoid bigger problems down the line.
Exactly.
That's incredible. What about the emotional and social aspects of care? Could AI play a role there too?
That's an interesting question. I mean, AI can't replace human connection, obviously,
Right.
or empathy.
Right. You still need that human touch.
Absolutely. But AI could be a great tool to enhance those support systems. Like imagine AI-powered chatbots that can provide information, resources, support to patients and their families.
Oh, that's interesting.
Yeah, available 24/7
Yeah.
and tailored to their specific needs.
So it's not about replacing human interaction. It's more like a supplement,
Exactly.
like having extra support when you need it.
Right. And we're seeing this growing focus on psychosocial support in general for burn survivors.
Yeah, that's something we've talked about a lot in this deep dive.
It's so important.
It is. It's not just about the physical healing, it's about the mental and emotional healing too.
Exactly. We're starting to realize that these injuries, they leave both visible and invisible scars.
And those invisible scars can sometimes be the hardest to heal.
They can. So we need to help burn survivors cope with the trauma,
Okay.
adjust to their new reality,
Right.
and ultimately, rebuild their lives.
Mm-hmm.
And the support that they need, it's got to be as individual as they are.
So what are some of the support services that you think will become more integrated into burn care?
Well, we're already seeing a lot of hospitals and burn centers offering counseling, support groups, peer support programs.
Which is great.
It is. But I think we'll start to see more innovative approaches too. Things like virtual reality therapy for PTSD,
Oh, wow.
mindfulness-based interventions for anxiety and pain management,
Okay.
even art therapy and music therapy to help patients express themselves.
It's like you're bringing in all these different modalities to create a truly holistic approach to care.
Exactly.
It's about recognizing that a person is so much more than just their physical body.
Right. And they need support on all those levels, physical, emotional, social, to truly heal.
So we've got personalized medicine, regenerative medicine, artificial intelligence, a growing emphasis on psychosocial support. It sounds like there's a lot to be hopeful about for the future of burn care.
There is. It's a field that's constantly innovating, driven by this incredible desire to make a difference in the lives of burn survivors.
Yeah, and that's pretty inspiring. Well, this deep dive has been such a fascinating journey.
It has.
And you've been an amazing guide, expert speaker. Thanks for sharing all your knowledge and insights with us.
My pleasure, truly. It's been a great conversation. And remember, knowledge is power. The more we understand about burns, the better equipped we are to prevent them and help those who've been injured.
And to our nursing student out there, we hope this deep dive has helped you prep for your exam and maybe even ignited a passion for burn care.
Yeah, burn care is a challenging field, but it's so rewarding. It's where science meets compassion.
It has been such a privilege to explore this topic with you all. Thanks for joining us on this deep dive. Stay curious, stay informed, and we'll see you next time for another fascinating adventure into the world of science and medicine.